Our next speaker is Dr. Ahmad Qabil Khalib. Dr. Ahmad Qabil Qabil is a consultant psychiatrist and director of Hospital Mesra Bukit Pandang, a psychiatric hospital in Sabah, Malaysia. He obtained his Bachelor of Human Biology and Bachelor of Medicine and Surgery from the University of Auckland, New Zealand in 1998 and 2001 respectively. Dr. Khalib subsequently obtained his Master of Medicine in Psychiatry from the Science University of Malaysia in 2010. In year 2016, Dr. Khalib completed his medical certificate in clinical hypnosis and later medical diploma in clinical hypnotherapy, both in 2017 with the London College of Clinical Hypnosis. Dr. Khalib has been practicing clinical hypnotherapy since 2017. The talk is titled, Looking After Frontliners, a Role for Clinical Hypnosis. And a brief abstract goes, the COVID-19 pandemic has put a lot of strain on both medical and non-medical frontliners across the globe. It has affected and continues to affect the physical and psychological well-being of many. Stress, burnout, anxiety, depression, and post-traumatic stress disorder are some of the psychological issues amongst frontliners that have been highlighted as a consequence of this pandemic. Various approaches can be beneficial to help, including clinical hypnosis. We look at the possible roles of clinical hypnosis, either on its own or as an adjunct to be used in this context. Thank you. If you have any questions, as before, type them into the Zoom chat box and Dr. Anna will sift through them for you. Thank you.
Thank you very much, Tom, for the kind introduction, and a very good day to everyone. I'll start my screen share. Thanks, Tom, again. As a psychiatrist, it is a privilege to be involved in the management of healthcare workers during these very difficult times. And it is also a very humbling experience having the opportunity to listen to a lot of people sharing their innermost secrets, the challenges that they go through throughout these 1.5 years. So what I'll be doing today is I'm going to share with you some of our experiences looking after our frontliners in these past 1.5 years. From early on, it was already known that COVID-19 brings with it mental health risks to frontliners. As reported in our daily local newspaper, the New Straits Times, this picture is from China. So early on in the pandemic, it was known that there will be mental health risks involved to the frontliners. So we started making our preparations to deal with this. So in Malaysia, we have our mental health and psychosocial support services, MHPSS, and we provide services to our frontliners, healthcare workers. And beyond that, we also provide services to our general public. As you can see in this picture, that is Dr. Nur Hisham, our Director General of Health. So from early 2020, we have activated our MHPSS, which is a system that we have at the national level, the state level, and the district levels. So we respond to disasters, and in this pandemic, we activated our MHPSS at the national level, right down to the district level. On the screen is a map of Malaysia. On the left is West Malaysia, where Kuala Lumpur is. On the right side is East Malaysia. And on the upper right is the state of Sabah, where I work. So the state of Sabah is comprised of a big area of nearly 74,000 square kilometers. It is the second largest state in the country. And the population in Sabah is nearly 4 million. So in the state of Sabah, we have our MHPSS comprised of psychiatrists, we have counselors, psychologists, family medicine specialists, occupational therapists, and other officers involved in our MHPSS. We proactively reach out to everyone involved in the pandemic. We have long lists of people to be contacted. We contact the people who are admitted in the COVID wards who are positive COVID. We contact the medical frontliners who are managing the patients. We contact the people who are quarantined, either home quarantine or quarantined in the quarantine centers. We also contact officers who are deployed from other places to another. For instance, deployment from one department to another, or deployed from one hospital to another, or even deployed from one state to another. And we also reach out to the general public. So we do not wait for people to contact us. We proactively reach out, and we make full use of technology. Apart from calling on the phone, we also send text messages. We reach out through WhatsApp. We go live on Facebook Live. We go on YouTube. We go on TV, on radio. Everything that we can do to reach out to the people, so that people are aware that we are here to assist. We are here for them. And we take the opportunity to continuously educate the public about COVID. So from the 1.5 years of managing this COVID, and for me, being in Sabah, being the head of the psychiatric service for the state, which covers 24 hospitals, and I also co-chair the MHPSS at the state level, which I co-chair with the head of the non-communicable disease unit head. So we have gained a lot of insight about what goes on in the minds of frontliners in their day-to-day work managing COVID patients. At the start of the pandemic, there was a lot of uncertainty and not much was known about the COVID virus and the risk of infection. So the risk of infection was a real threat, was a real worry that we faced. And looking at, I hypothetically put two groups of people. One group of healthcare workers who are working in the COVID wards, managing the COVID positive patients, and group B being medical frontliners who work in other areas of medicine, whether it is in the emergency department, in the general wards, or in the health clinics. Who do you think would be more susceptible to stress, group A or group B? We thought initially that group A would be more susceptible because they need to deal with the COVID positive patients. But as we speak to them and gain understanding of what goes on in their minds, we had the realization that the opposite is quite true as well. This being The group A people who are working in the COVID wards, they say, well, we know that we are dealing with COVID patients, so we take full precautionary measures to protect ourselves. We have the full set of personal protective equipment. We adhere to all the standard operating procedures. We follow everything by the book to minimize the risk. Therefore, we feel that the risk is manageable. If you look at Group B, for the medical health workers working elsewhere, they will tell us we are short of PPEs. We do not know the status of the patients that we are dealing with. People come to the emergency department in droves and we don't know their status. We need to speak to them, we need to take their history, we need to examine them. So then we realize that, oh, Group B is actually facing a lot of difficulties and facing a lot of stress. So that is one of the insights that we gained from speaking to our frontliners. And secondly, the worry about infecting family members, as rightly pointed out by Dr. Srilata earlier. We have had frontliners who decide not to go home upon finishing their shifts. They say, it's okay, I'll sleep in the hospital floor. I don't mind because I have a small baby at home or have an elderly parents at home. I do not want to go home and infect them. So it's very sad. It's very sad when this happens. And when they speak to us, many of them cry and become very tearful, sharing what they have been going through. And another big thing that we faced was stigma by the community. At the early part of the pandemic, many people had the misunderstanding about the infectivity of the virus. Healthcare workers were stigmatized. We even had nurses who went to restaurants but were turned away because they were nurses. So this did happen very, very sadly. And also being quarantined as close contacts can also be very, very stressful. Sometimes people face this feeling of guilt when they are quarantined because they come into contact with a positive patient. Being quarantined itself takes them out from action, and they have to sit and look at their colleagues struggling day in and day out, whereas they are quarantined. So this feeling of guilt is burdensome as well. And added to that, we had limited resources, not only the PPEs, we had a lack of resources in terms of human resources as well. There was a lot of deployment from one place to another. We had groups of workers being quarantined, and we had to quickly ferry a team from another hospital or another part of the state to cover those other units which are affected. So people had to adapt very quickly to a new style, to a new environment, to new colleagues. It can be very, very stressful. And at the start of the pandemic, things were quite chaotic, and deployment was done on an ad hoc basis. And many of those officers were not mentally prepared for the deployment. I'll give you an example. Someone from a big city with all the luxury of the big city being deployed to a small hospital in a small district, some have difficulty to adapt because where's my Starbucks, where's my KFC kind of thing, right? So we put forward to the ministry that please, we need to do pre-deployment briefing. We raised it because that's what we learned from the healthcare workers. They were not prepared. So then we came up, the ministry came up with a pre-deployment program to properly inform and educate and get the people to be prepared for what to expect in the place of deployment. Right? And with the long work hours, inadequate rest, and a challenging work environment, as shared by Dr. Srilata earlier, it's taking a toll on all of us. And added to the fact that it's now running into 18 months and beyond, and we are not yet seeing the end of the tunnel. So yeah, it has been very stressful. We, the frontliners, have had our leaves frozen for many, many months. Many of us have not met our families for many, many months. So it has been very stressful for many of us. So apart from us reaching out to people via telephone and social media, we also try our best to prepare other things that we can help with. For instance, some hospitals take the initiative to prepare a resting lounge with a massage chair, etc., to make our healthcare workers feel a bit more comfortable, feel catered for, and being supported. So these are the things that we do. Even for me, myself, just 2 days ago, me and my team, the psychiatric team in the Sabah state, we sent a fruit basket to our state health director, just to show our token of appreciation and our sign of support for the ongoing battle. So those are the things that we do to support each other. And for us, that in the MHPSS team that has been reaching out to people, we have had mixed reactions from the people that we reach out to. We have had people who, at the very mention of us being from the mental health and psychosocial support service, some people break down in tears immediately. They feel that all this while they are so stressed and they had no one to talk to. So when we reach out to them, they break down in tears and they share their grief and the issues that they have been going through. So we have had that a lot. And for me, being the coordinator and the head of service for psychiatric service in Sabah, I am tasked with caring for the senior officers, the heads of departments, etc. So I tend to get referrals for the complex higher ranking officers. And we've had high ranking officers who usually put up a very brave front in front of their staff. They need to be strong. They need to be strong. They put up a brave front, get things done. And that's what they do day in and day out. But when we speak to them, coming from an MHPSS service, many of them break down in tears as well. And I'm not only talking about medical frontliners who work in the wards or in the emergency department. Everybody's affected. Even people who work in the laboratories are affected as well. Just imagine at the start of the pandemic, with all the chaos, the rates of doing the tests, it was pretty slow at the start. And people were pushing and pushing to get their test results quick. And it put a lot of strain on the laboratory personnel. They work double shifts continuously. They sleep in the laboratories. They don't go home. And it was very, very stressful. But these are the unsung heroes. We don't see them on TV. We always see our frontliners in the full PPEs with the face masks and all the overalls. But not to forget, we have people who are the unsung heroes as well, working in other parts of the healthcare facilities. So as expected, there is a lot of stress, anxiety, depression, and even post-traumatic stress disorder amongst us, the medical frontliners. Some became very traumatic when they became COVID positive because some are blamed for creating a cluster of infection, etc. They are shunned by their colleagues. So it causes a lot of stress and trauma to everyone. Just to share with you a couple of papers like this one by Salari et al. In 2020, looking at the prevalence of stress, anxiety, and depression within frontline healthcare workers caring for COVID-19 patients, a systematic review and meta-regression. Looking at 29 studies, they found the prevalence of depression being at 24%, anxiety 25%, and stress at 45%. So that's hardly surprising. It could actually be higher. Secondly, I'd like to share with you this paper from Cochrane Library, which is a systematic review looking at the interventions for supporting resilience or mental health, mental well-being of frontline workers during disease outbreaks, not only for COVID, but prior to COVID, going back to 2002 till May 2020, the studies included studies from severe acute respiratory syndrome, Ebola, Middle East respiratory syndrome, and COVID. So the interventions that they looked at were work-based interventions like training, structure, communication, etc., and psychological support such as counseling, psychology services, etc. So they had the conclusion that there were facilitating factors to the implementation of interventions, and there were also barriers to the implementations. As for the facilitating factors, it is rightly pointed out that the interventions that we carried out must be adaptable to the local area. I think that's something very important for us to learn, that even if we have a national level initiative, we have to make it flexible enough to be adaptable to the local area to make it a success. Secondly, effective communication, both formal and informal communication. And thirdly, positive, safe, and supportive learning environments. These all contribute to facilitating the implementation of interventions. For the barriers to implementation of intervention, frontline workers, or if the organization are not fully aware of what they needed to support their mental well-being. Some heads or the bosses might say, yes, we do have a problem, we do have workers who are stressed up, but what can we do? What resources do we have? How do we reach for help? So these things become a hindrance. So that's why we need to continuously educate, provide our services, make it easily reachable so that implementations can be done successfully. And secondly, the lack of equipment, staff time, or skills for intervention also become a barrier. This is our Minister of Health, Dr. Adham Baba. This article is fairly recent, May 21st, 2021. He talks about how our psychosocial support services has been swamped by people asking for services. And this has been going on for a while, actually. But we do a lot of things with our psychosocial support services. Apart from calling people, we distribute information, infographics, and we do psychological first aid, etc. And as mentioned in the article, there are 4 mental institutions, 62 government hospitals, 1,161 health clinics, and 28 community mental health centers, which are complementary, all providing MHPS and services. And we will continue to do this for, I don't know how long, but we'll hang on. And we always tell each other, we have this hashtag in Malaysia, kita jaga kita, means we look out for each other. And like what I mentioned earlier, just a couple of days ago, we sent a fruit basket to our state health director as a sign of support. And we will continue to do this to support each other throughout these very challenging times. So coming to hypnotherapy, for us hypnotherapists, what can we offer? A lot can be offered through hypnotherapy, but we must come back to the basics first. Empathic listening. That's the most basic, and it's very, very important, which I can emphasize more. As what I mentioned earlier, people break down in tears, and having a listening ear who will listen to you without judgment and not giving advice, just listening to you and let you ventilate can be very, very, very therapeutic. So that's very important. But at the same time, you also have to prepare that different people react differently to stress, and different people have different levels of resilience. And some people are not open to talk about their feelings. We have had people who, when we introduce ourselves as calling from the mental health and psychosocial support service, they'll say, "Oh, I'm okay, I'm totally fine," right? But we don't know what goes on deep down inside. Right? But what we do is we just let them know, if you're feeling fine, that's good. We wish you well. If in the future you do need to contact us, we are here for you. So that's just a very strong message to everyone that we are here for them. So for us as clinical hypnotherapists, we can do a lot in terms of stress management. We can deal with the symptoms of depression, anxiety, insomnia, etc. And those who have been trained in trauma work, we can proceed with trauma work. This can all be very, very helpful. And anticipating that this pandemic will carry on for a while more, we can look into this and provide services for the people. But it's also important for us to know our own limits, and we know when to refer. Right? For me as a psychiatrist, we do get referrals from our counselors and psychologists and our doctors. People develop new psychiatric disorders. People have a relapse of their pre-existing disorders, and people become suicidal. People actually attempt suicides. We have seen a spike in suicide attempts, even amongst youngsters. So please always be aware of our limitations, be safe, refer when necessary. So as a conclusion, frontliners in the prolonged battle against COVID-19 are at risk of depression, anxiety, stress, trauma, and other psychological disturbances. There are various approaches, including hypnotherapy, that can be used to provide frontliners with psychological support and assistance. That's all from me. Thank you very much.
Thank you, Dr. Qabil, for that sharing. I think you've given us a really good insight to, what the frontliners face, because it's not just the stress at hospital. You're talking about the stigma. I think there's just so much for them to it's such a big burden. And I think our participants also, they want to know how they can help, meaning if they want to extend their help to MHPSS. Is that possible?
The formal service from the Ministry of Health, but we do have many other organizations and NGOs which work alongside us. We have the Befrienders, we have various NGOs like Mercy who provide counseling services as well. So it doesn't have to go through MHPSS. We work parallel to each other. So there is a lot of opportunity for clinical hypnotherapists to play a very positive role in this as well.
And okay, I've got another question here. So now we've been reading about how the number of deaths have also been increasing, and we've also been reading, and I think Dr. Lata also had shared, saying that these doctors are having to make a decision on who gets to be admitted or who gets a chance. I think she put it in that story just now. So how? And this is really a big impact on them. So we've got a question from Chandru Kanesan here asking, how are they being supported?
To make such decisions, it is always a good idea to have a collective decision rather than one individual taking the responsibility, because it puts a lot of pressure on the person. Right? And but at the same time, we clinicians have been facing this even prior to COVID. We have had to make difficult decisions about who to resuscitate, etc. But this pandemic makes it much more difficult. But for someone who has had to go through that difficult experience, having a listening ear would be very beneficial. Just to ventilate, just to speak up what was going on in your mind when you had to make that decision. We have self-doubts, we have guilt. Did I make the right decision? Is it sinful to do this kind of thing? But to have a non-judgmental listening ear, just to be there for them, will be very, very beneficial. So whether it's clinical hypnotherapy or some other kind of psychotherapy, it doesn't really matter, as long as the therapist is empathetic and listens without judgment and provides support, unconditional support, that will be helpful for the frontliners.
Thank you, Dr. Qabil. I think you've helped us understand better what are the trials and challenges that the frontliners, and not only the frontliners as depicted, as you say, it's actually a larger force than that. There are many people behind the scenes. Okay, thank you so much, Dr. Qabil. I think that's it for the questions, and I will pass it back to Tom.